And we're having so many people who have gotten the kidney disease that now will end up to this person doing dialysis.
How can one get kidney injury?
So the first thing is in case of toxicity or drugs.
Okay.
Because there are some drugs that are metabolized in the kidney. So you find we call them nephrotoxic, like they are toxic to the kidney. One of the leading is hypertension, and we say poorly controlled hypertension.
If you could mention one type of food that one automatically you're going to be told not to consume it, what would that be?
Banana.
Oh,
yes.
Yeah. But now, which are signs that they can look out for, and you tell them now that one, go to the hospital, you need to check?
The typical, one will notice is this person was producing urine and now there is no urine.
Okay.
Because through the kidney is where we get the urine. That means after the washout, we get urine as the end product with all these toxins.
Where we shine so bright, she goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, excitement in the air, friends and guests joining us.
Hi guys, by now, at X Living, we also pride ourselves being a show that educates the society and also tries to defy the myths that surround us. Today, we are privileged to have someone who is going to dwell deeper into a topic and a condition that many suffer nowadays and many have to go through the treatment, dialysis. When even you go to Google and just Google dialysis, you'll get the explanation as the removal of excess waste and fluid from the body. But now that's where it ends. You need to know more, and especially if now you have a friend, a relative going through this. Thank you so much for always supporting us and always coming back every week. Let's continue subscribing, liking, and sharing. That's how we get to grow. That's why we get to bring in more guests. And as always, you can forget to thank our sponsors for this show, Chris Park Medical Center. We'll put all the details down below and everything that they deal with. Asante sana. Karibu sana. If you could be so kind to introduce yourself.
My name is Jennifer Karanja. Professionally a critical care nurse, working in Chris Park facility as the coordinator of all the critical care unit and the dialysis unit. Now, we're just going to go straight to it because I know we're also stealing you from very important things that you've got to do. Sure.
Before even we get to dialysis, what are some of these conditions that may make one need dialysis?
So currently, dialysis, as we call that is the kidney disease, has come out large. Because we have so many numbers increasing every day. It used to be something like a hard story, but now they are happening, and we're having so many people who have gotten the kidney disease that now will end up to this person doing dialysis. For sure, like basically in our county, previously, if we go back 5 to 10 years ago, we didn't have so many facilities that used to offer dialysis. So all these people that had kidney disease, they had to go all the way to Kenyatta. Like if I go back 10 years ago. But now, because of the numbers are increasing, and since we have the health devolved to the counties, we got one facility to the county, and now we have so many other facilities that have started offering the service because of the need, the community need. Yes.
And now, as I mentioned, of course, we hear dialysis. It's a name that is thrown everywhere. As you've mentioned, now it's something that is all over. So, of course, I've given the Google meaning. What is dialysis?
So, as we say, dialysis is a therapy for that person that a kidney is not working normally as for mine and yours.
Yes.
And now the functionality of this kidney has been affected such that we know it helps us to remove the toxin, all the excessive waste. So these waste now, your kidney is not able to remove them. So through a machine, we are able now to help your body remove these waste. Basically, the body waste. After eating, after the metabolism, after everything that has gone through your body, now there are those head waste. So your body is not able to remove them. Now we are doing them manually via a machine, which now is the therapy we call dialysis. Yes.
Now let's get into this person that now needs dialysis. Is it that everyone that has a kidney problem will need dialysis, or are there cases where someone is just, if, for lack of a better word, has a mild kidney condition and won't need the dialysis?
So there are stages through consultation with the nephrologist. We are able to define which level needs dialysis and which level does not need dialysis. So it depends with the level of dysfunction of this kidney. Through their lab tests that we do, we call them the kidney function test, that will define for us how bad is this kidney. And how bad, with the levels that are there, now will guide you, does this person need dialysis or not? And if they need dialysis, we say, now we see, is it an acute kidney injury or it's a chronic one? So we have the acute cases. For example, one has taken a toxic drug, and we need to wash out this toxin, which is now, that's one example of an acute. Or even there are those that are on acute kidney injury because now the illness are just, this is someone who has been healthy, but they have gotten this illness. We call it's an acute phase. And now to this level, we are able to dig deeper too. Is this person, the level of injury, was it a level that will get better, or it's that level that we will continue? So these are the ones that we call, they are on end-stage renal kidney disease. So it means it's, on a simple word, it's a chronic. So this person might need to dialyze till the days that God will have given you. And there's these other now that they improve, the acute phase. They improve gradually, and that we stop doing the dialysis because now the kidney's functionality will have gotten better to the state of a normal kidney. So for those ones, we don't dialyze for long. Yes.
Okay. If I could pick your mind on that, especially the chronic ones,
Sure.
we also hear of kidney transplant. Do they fall under that category?
Now, through the test evaluations that now are done with the help of a nephrologist, there's this follow-up that we do, and now we are able to establish that this kidney, the probability of coming back to the normal functionality, it's like zero. So we consider even age. This is a young person, energetic, maybe below 50s and 60s, very productive. Because we have even pediatric population who are getting the kidney injury, because we have many things that can lead one to a kidney injury. I think we'll come to that. So you find that maybe this is a person at the reproductive age. So this person has hope of more years to stay. So we want to do a kidney transplant such that now we are able to make a good function of a new kidney. Yes.
Now, like you've mentioned that one can get a kidney injury. Maybe if you could mention some of the ways or how can one get kidney injury?
So the first thing is in case of toxicity or drugs.
Okay.
Because there are some drugs that are metabolized in the kidneys. So you find we call them nephrotoxic, like they are toxic to the kidney. And at the level, maybe at the level that they are toxic is the level that they really compromised the functionality of the kidney. So that is one way. The other way is we have the underlying condition that might lead to kidney injury. One of the leading is hypertension, and we say poorly controlled hypertension. Hypertension that has been poorly controlled, because you see the way blood flows to the organs of the body, and now we don't go deep to the physiology part. This poorly controlled hypertension will lead to a kidney injury. So one is that. The other one, we say even diabetes can lead to that. We also have various cancers. One of the predisposing factors is because of even the drugs they are taking, because they are quite nephrotoxic. So you find they injure the functionality of the kidney. Also, we have hereditary, like genetic. It is not known the cause. Yes. And then there is those abnormal anatomical, those people that are born with a defect, anatomical defects in the kidney. You find that anatomically there's something that is wrong with this kidney, the way it was formed. Like those ones we don't have control. You just find out as someone grows. Then we have obstructive. We say that through the urinary system, that is the urinary system, we have an obstruction. So this obstruction will lead to the kidney straining and also now damaging the kidney. So there are various things that can lead to that. But one of the leading factor is hypertension. The most leading. And you find that during the early age, maybe you have hypertension at early age, and you have not gotten serious to controlling this hypertension, because you find some of us, it's normal to young people, and we are not serious sometimes with these conditions that come early in life. So you find you didn't control it well. Meaning controlling is you're taking your drugs well, you're going for your follow-up. So in case the drugs are not controlling well, or through the follow-up now with the physician, you're able to be, we change drugs, what we change, So you find that now it was not well controlled. Now that leads to the kidney. It is the most like a causative. To most people.
Okay, like I mentioned when I was starting, we pride ourselves of being a talk show that is also educative. So we want to give, the information like as if you're explaining literally to a 2-year-old. So we've been mentioning hypertension. In layman's terms, what is hypertension?
So in the simplest word I can say, it's the high blood pressure. Let's say the blood pressure.
What is BP?
Yes,
we loosely call it BP.
Yes, what we easily call it BP. So you find that once someone gets this BP, you need to be
on drugs.
That will help you control. But you find that after some time, people think that I've taken these drugs for some time, so the BP is normal. But you fail to understand that the drugs that you've taken have made your BP to be normal. So you leave the drugs, the BP will go up again. And every time you have a shot of BP, it will injure something in your body. Yes.
Wow.
Yes.
Yeah, because I've heard of cases where, of course, Even we have our own parents at home who have BP, and you take drug today, tomorrow they are not taking. They will say, I went and they checked and it's normal, I don't have to take the drug. So I feel that is something that really needs to be sensitized, because really people think I just take drugs 1 month, 2 months, and that's it. So when it comes to blood pressure, the drugs are for life.
Um, I can say very few cases that you get that when it comes to blood pressure, there are so many things that you have to consider.
Yeah.
For example, you have to consider the lifestyle. So there are so many things that changes.
Yeah.
So apart from taking drugs, apart from follow-up, there is the lifestyle changes.
Yes.
Because you have to have a healthy life, exercise, you have to eat clean, you have to be so keen on what you're taking, because now you don't want to get those things that will lead you to this high pressure. But the main key thing is when you're on drugs, the drugs is making your hypertension to be normal.
Yeah.
So you withdraw the drug, then you when you like take the BP for 2-3 times, and it has become normal. Now you tend to think that things are well. You've forgotten that it is the drug that made your BP to be normal. So we withdraw it, after some time it will shoot again. Yes. And I always say withdraw with like advice from your doctor. Yes, from your doctor. Yes.
Okay, sorry I deviated a little bit. I really wanted them to get that part.
Okay.
So back to dialysis. Of course, like you've explained, this machine is helping you to take out the toxins and the waste products from your body because your kidney can no longer do that well. So how many times does this person need to do this? Is it weekly? Is it monthly?
So the recommended schedule is usually twice or thrice a week, depending on the level, the injury, or the extent of the injury. So there are those who will do thrice, there are those who will do twice, and there are those that you find the functionality of the kidney has come near to normal. We even do once a week. So it depends. It's very individualized. So I can't say everyone who starts dialysis will do thrice. It depends. And now we are keenly guided by the nephrologist. Yes. For example, we are in our unit. We are privileged to have a nephrologist on board who manages our clinic.
Here at Gracepark.
Yes, here at Gracepark. So you find all those evaluations are done keenly, and now he recommends who needs twice, who needs thrice, and who needs once. This is now through the response I'll give to him. That these are the lab tests. This is how patient A and B is doing. Now we get to decide. Let's do thrice. As it goes on well, we can now taper down to twice. But there are those people who will carry on twice or thrice for so long. So it is so individualized. Yes.
So now if you could paint a picture for us, this person that now is starting dialysis, what happens? Because of course, I'm trying to imagine someone is watching and maybe they have a friend or a relative, or it's even themselves, that they've been told they need dialysis. They've no idea. They are Googling all sorts of things and now they're scared. What happens when they come in?
So immediately we do the evaluations and now get to that level that this is a kidney that is at the level of the need of dialysis. The first thing we do is we have to fix a catheter. So this catheter, it's, let me say in a layman's like a way everyone will understand. It's something that helps us to get blood out of your body, to go through the machine and take it back. So it is a continuous, not that I'll pull out all the blood, put it in a basin, then clean it, and then I am put it back. No. So through this catheter, I'm able to remove blood, like bypass it through the machine as it's going back. So it's like a cycle. It's coming, washed, and going back.
Yeah.
Yes. So through this catheter now, it's what I'm able to get out your blood
Yeah.
from your body to the machine. So we have two types of catheters that we do consider. We have a temporary. That means this temporary is for a temporary use, a short-term use. And we have a permanent catheter. This is something that the catheter that we'll use for long-term. So within the evaluations that we said, you're able to say this is something that now we're on the chronic phase. This is an acute phase. So if it's something I can see that this person needs dialysis, but not for so long, I'll consider the temporary. But now it's fixed by a surgeon. There are various sites that we can use. And also the permanent is fixed by the surgeon. Then now after then, it's normally recommended to do first 3 consecutive sessions, which is today, tomorrow, and the other day. So we say it's on incremental of hours. Usually, we have those dialyses that take 4 hours, the usual. But we can also do them even longer, to even 6 hours. And there is advanced ones that even go for more hours. That one is in a setup. But usually, in the normal occurrence, they come to the dialysis unit as a short-term period. So if we fix today, we'll do 2 hours. Tomorrow we do 3 hours. The other day we'll do 4 hours. Then from there, through the guidelines that from the doctor, we are able to see where we have a resting phase, whereby we are evaluating the patient, knowing there are those things that we consider. We now schedule. We schedule twice or thrice in a week. Yes. Yes.
And now, now these patients have started dialysis and all. Do they continue with their normal life, or are they things that now they are going to have limitations?
We usually say it is a game changer. Because now we have things that this person they have to change, starting with the diet. Remember, for example, on a normal person, we expect our kidneys to help us remove the excessive water in our body. So this is a person that kidney is not working well. So we will expect more water will be retained in your body. So one of the first things that you'll hear someone tell you is we have to reduce the amount of water that you intake every day. Because now your kidney is not able to remove all these amounts that you're giving it. The diet also, it's so broad. If we talk about diet, it's like a whole session. There is the advised diet for the diabetic, for the kidney injured patient. Yes. And this now, after we have started you on this therapy, we sit down with you, the family, and the nutritionist. Because there is the way this food should be prepared. There are those things that you have to put away, like forget. Yes. For example, those like for example, I'll say those food that is high on urea, on potassium. Those are very, very key things to pick. Those ones will say you have to. So it is a game changer. But our key is we want this person to be a client. You see, a client is someone who comes for service. After the acute now phase and someone has been discharged, you'll continue coming to to our clinic or to our unit, visiting, like doing the dialysis every week. So we want you to be healthy, such that there's nothing else that is limiting you to going to your work. So you're coming, we dialyze, you go home. Client, we say with the client, they get service and go back to them. For the patient, now they have to remain to the hospital. So we want to retain that quality of life through the dietary change, all the advices that you need. If we now have to put you in the process of change the kidney transplant, you say, we have those follow-up that we have the various tests that we have to take. We want to maintain this kidney to a level that we are able if to dialyze. If we are able to dialyze you the shortest time, it's a while to us. If we are not able, then we are able to maintain the quality of your life despite having this condition. And when I was talking about, I think I forgot to tell you there are other ways apart from catheters. The other things we call graft and fistulas. So these are permanent ways of like accessing your blood. So a fistula is put on the heart. So it's something that it's not a device, but there is the way the surgeon creates the fistula. So it's also permanent way, like access to the blood. Yes. So we have catheters, we have fistulas, we have grafts. So it depends even to the ability in terms of affordability. Yes, but you find the catheters are more affordable than the fistulas and the grafts. But all these ones, we can get them even here. Yes.
We value your feedback. It is invaluable in helping us understand what we are doing well and where we should improve to meet your high standards of care. Talk to us via our customer support line that is available to you 24/7 on 0111 053 800 or through our social media platforms.
Okay, now, just out of curiosity, you've mentioned about, of course, foods that are high on potassium and urea. If you could mention one type of food that one automatically you're going to be told not to consume it, what would that be?
Bananas.
Oh,
yes. Bananas, they are high on potassium. Urea, the cereals. But there is a way now they are prepared. You see, we can't say you don't eat. But for bananas, we'll say don't.
Wow.
Don't. For the cereals, we have to leach them. Like you have to soak them, pour the water, then come boil them, pour the water, then now you cook.
Continue.
Now you cook. So that's why now we are including the nutritionists and also the family members.
So that they can know how to prepare. Support even this.
Because it really needs support. Because now after you're off the unit where I am, I need the family to be keen.
To be keen on,
because I'm not with this patient even at their homes. I remember they'll never stay. They'll not stay in the facility forever. At some point they have to go home. So we need the family to be on board. Yes.
So as we come to the end, what is your parting shot? How do you encourage maybe someone that is watching and has just been diagnosed with any type of kidney disease and now has to go through dialysis, and now they're thinking this is a death sentence, I am done. You know, they even started asking for their will and everything to sign off everything. How do you encourage them? What would you have to say to them?
I usually say it's not a death sentence because it is something that we can have control of the disease. Because we are able to remove the toxins for you manually. So if we say today, Jennifer, I have a kidney disease, the first thing is acceptance. So that now I'll be able to keep the requirements that are needed. The second thing is I need follow-up. I need to see I need to see a nephrologist. I need to be on board on physician. I need to be on board with the nutritionist, because all these things that are needed to pull through this journey, because it's a journey. But I have seen patients who have dialyzed for even more than 10 years, and they're hopeful of life. Even you don't know. It will distract your schedule, because now, or let's say on Mondays I have to be in hospital, and on Thursday I have to be in hospital. But it's something that you can reschedule and live with it. And maybe tell yourself it's like I'm taking my body to the garage or the car wash every, like we do for the cars. I have to go. If your car is so busy, you have to go to the car wash maybe once. Then you tell yourself, I have to take this car twice a week. It is not easy, but it's a journey. Then now, with the follow-up and the discipline of I'm not able to take this, I'm not able to take this because of the end result. That I understand my body very well, that if I give it this, it will not be able to remove it. So I have to minimize or keep off. So with that mentality, it gets easy. And if we are able to go the transplant way, we usually encourage that. If we are not able, because you can be so willing at your tender age, but you don't get a donor. It's not the end of the life. We can be doing this dialysis as the schedule is recommended, and no one even knows, because you're taking your drugs well. There are no toxins in your body. Of course, there are those low times that the body is really compromised, but we'll pull through. So I usually give people hope, because I've seen people dialyze for long, and they are there even today. They are coming in our unit, we are dialyzing them. And discipline is key, follow-up is key. Those two things, because you'll need this thing. Yes, and through that we achieve a very good level.
Another thing I have to ask, either you're using the fistula way, the graft way, or the catheter way, and now you're using the permanent method that you really have to stay with it. Is it something visible? Is it that everyone will notice that you have it?
No. Because the way they are placed, they are the femorals, we have the jugulars, and the fistulas. Mostly they are on the brachials. So when you're dressed up, no one knows where that thing is. You're the only one. Maybe even some get shocked. Oh, this thing has been there. Because it's not something that will be painted here that you have a catheter, or it's put somewhere that it's somewhere comfortable. Where even we dress up and we sit down here, no one
notices.
Because people grow this stigma that I'm going for dialysis. But I usually say it's a therapy like any other. Like we go to the gym. But I think people have gotten this stigma because it's a hospital therapy. But I think acceptance makes you now accept. It's like those who go for gym. They're very proud because maybe the outside community there has never painted gym as something negative. Bad, But I think the way we embrace it, because you find in Western countries, like the developed countries, people even do this dialysis at home. Because as I said, we have we have hemodialysis, we have peritoneal. So you find that in those developed countries, people are able even to do dialysis at their home. You're trained, you know how to take care of it, you have the resources, you buy them and do them at home. But now deep down in our community, you have not gotten there. So you have to go to the hospital to do this dialysis. So I think the way community has painted it like as something negative. But it's a therapy like any other. Like you'd hurt your leg and you have to go for physiotherapy. And you'll say proudly that I'm going for physiotherapy.
to get your leg functioning again. Yeah.
So it's also a therapy that should people look at it positively. It's a therapy for the kidneys. Yes.
Yeah.
Yes.
And now, as we really need to wrap up, but signs that one should look out for this person that is totally healthy, but now which are signs that they can look out for, and you tell them now that one, go to the hospital, you need to check up.
The typical, like one will notice is this person was producing urine and now there is no urine.
Okay.
Because through the kidney is where we get the urine. That means after the washout, we get urine as the end product with all these toxins. Now, if your body is not producing, or even the amount you see it's reduced, regardless of the amount that you have taken, we have very little amount. That is one of the cardinal signs, especially to our now the elder people in our homes. You see that for 2 days I've not seen urine. So that's it's one of the worrying things. The other thing that maybe the puffiness. But you see, if I say puffiness now, the other condition that can present the same. That's why I don't want to go to
so
the
the
signs.
major one would say
The reduced urine, urine output.
Okay.
Yes.
And now at Chris Park, the clinics are offered any other day, or are there particular days?
We are privileged to have a nephrologist. I think in the region here, we have the facility that as a nephrologist. We have Dr. Kakai, who is our resident nephrologist, and his clinic are scheduled on Saturdays. So that's when he's able to see all these patients that need kidney care. Not only the dialysis patients, because there are those of us who have kidney issues, but we don't need dialysis. And there are those of us who need dialysis. So we say for the kidney care. So he schedules the clinic Saturdays. Yes. So if you give a call, you'll be explained to this Saturday, and the clinic starts at 10 whole way through the day. And we are glad that we have a unit that is run by a nephrologist, because now at least we know you're taken care of. With a specialist on board. Yes. Then we have specialist nurses who does the dialysis now every day in consultation with the nephrologist. Yes. We have machines that can take care of a big capacity, because we are able to do to a total capacity in 24 hours. We are able to do 18 sessions in a day. That is in 24 hours. Yes. So we can take as much as that. Yes. So we are growing gradually, and our services are covered by SHA. So as long as you have SHA, and SHA covers dialysis package, you're safe. You know that now I don't need to pay for this, because it's a bit costly. The therapy is a bit costly, because even for the rich people, let me not use the rich, like the able people, being asked for 10,000 per session. Because the SHA covers 10,650 per session. So if you'll do thrice, that is 21,000. If you'll do twice, thrice, that is 32, like 32,000. If you'll do twice, that is like 20-something thousand. Yes. So you see, with the help of this SHA, we are able to keep our patients coming and taking care of them. Yes. Wow. And now the beauty about our facility is, for those who dialyze with us here, they see the nephrologist at no fee.
Okay.
Yes, because now you're our client. Yes. Yes.
Okay.
Yes.
That is very nice to know. I am sure our viewers have learned a thing or two. And thank you so much, Jennifer, even for finding the time. I know we've pulled you for very important things that you have to do, but thank you so much even for, you know, providing that knowledge that is very much needed. You know, of course, we get to kill even the myths that keep these people at home and keep them away from getting the medical care they need and early enough. So asante sana na ubarikiwe.
Thanks so much.
Thank you so much for staying tuned to today's show. As we keep saying, knowledge is wealth. And that's why we keep on bringing these topics that, you know, may seem common, may seem as if they are knowledgeable and people are knowledgeable about them. But really, if you go deep and ask some of these questions, there are so many people who don't even know where to begin from. If you have any question, any further questions about the same, you can pass them to us and we'll pass them to Grace Park and they can get to answer your questions. Kindly let's keep on subscribing and following all our social media pages so that we can keep on growing and keep on being able to bring these guests every other day. Asanteni sana and see you next week. Bye bye.
2 weeks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and challenges, excitement.